When you say holistic approach, what do you exactly mean in skincare?
So your brain, your gut, and your skin is always communicating, maybe through hormones, certain immune pathways, and it is not independent of each other. If you're sitting in a room and if I can see you, there's UV light. If there's UV light, there's UV damage. Besides, I think even as dermatologists, we are often the first point of contact for people coming with a lot of internal issues. Like say we pick up lupus for the first time, sometimes we pick up cancers for the first time. Beauty is not skin deep.
Top 3 foods that people should avoid when it comes to aging, which causes inflammation.
Dairy, sugar, gluten.
How does a lifestyle plays in aging your skin?
Whether it's your sleep, your diet, your nutrition, exercise, I think everything eventually adds up.
कब किसी जने को अपनी एंटी एजिंग के बारे में सोचना चाहिए? Is 40 is the time या फिर 25 भी ऑलरेडी बहुत लेट हो चुका है?
I don't think it's ever too early.
Do you think losing weight can also make you older?
For sure. So there's more facial sagging and there's more lines. But if you want a face closer to natural as you grow older, then you've got to start young.
Does facial yoga can reverse your skin aging, or is it effective for aging?
In all probability, if you're doing a lot of facial yoga, you're probably going to get lines earlier.
In your practice, do you learn that men age faster than women?
So I think men don't take care of their skin as much in their younger days as women. It's extremely hard for me to convince a male patient to use sunscreen. We do have a lot of male patients come by the suns, but most of them are brought by their wives or girlfriends. So the care has been really poor, right?
So you're saying prevention is better than cure?
Absolutely. Retinol is my favorite because it does multiple things. It treats acne, it has anti-aging properties in a different concentration maybe, it treats pigmentation.
Top 5 diet for anti-aging.
Try to include 5 colors in a day for the antioxidant part of it.
Sleep is the most effective natural anti-aging treatment.
Couldn't be more true.
Welcome back to Raw Reflection. Today we are diving into a topic that everyone has question about. We are talking about anti-aging. Now this is the most talked about conversation in our time.
Everywhere you look, people are searching for the next best solution for anti-aging, whether it's to skincare, lifestyle, or anything deeper. And we get that. And that's the reason we are too excited about this particular podcast today.
And that's why we have Dr. Sama Rais. She's a clinical dermatologist since last 10 years and believes in holistic approach towards skincare and approaching anti-aging. So let's dive into the topic right away.
Hello, Dr. Sama.
Hello. Pleasure to be here with you all today.
Likewise. So, doctor, my first thing is what and why you got into dermatology?
Okay, so I think dermatology is a very vast, very intriguing and very evolving field. So right from when I did my residency in dermatology 15 years ago to today, the way lasers and anti-aging has evolved, it's just completely a new chapter. Besides, I think even as dermatologists, we are often the first point of contact for people coming with a lot of internal issues. Like say we pick up lupus for the first time. Sometimes we pick up cancers for the first time because they have a typical skin presentation. So I think it's very intriguing that it's very holistic. And that's what has always kept my interest. And anyone who knows dermatology knows for a fact that beauty is not skin deep.
So you just said holistic approach, right? And you always believe in holistic approach, and you are also our dermatologist, and you're the most trusted dermatologist that we always reach out to, and you have always suggested us the most holistic approach first and then going for clinical procedure. So when you say holistic approach, what do you exactly mean in skincare?
So when we say holistic, there's one aspect which not many people know. So there's something we call the gut-skin-brain axis, right? So your brain, your gut, and your skin is always communicating maybe through hormones or certain immune pathways, and it is not independent of each other. So if, for instance, even a case as simple as acne, pimples, we don't fix your gut microbiome, we don't fix your skin microbiome, or people are stressed, there's a lot of anxiety, depression, there are other neurotransmitters which upset your hormones. So it's always interlinked. So we are always trying to fix your lifestyle, fix your diet, fix your nutrition, besides your medications, and then of course our lasers and treatments. And same applies for anti-aging.
Oh, so कब किसी जने को अपनी एंटी एजिंग के बारे में सोचना चाहिए? Is 40 is the time या फिर 25 भी ऑलरेडी बहुत लेट हो चुका है?
So if you've, I don't think it's ever too early, because so right from the age of 20, you're losing at least 1% of your skin collagen every year, right? Sun damage starts from children exposed in playgrounds. So all of that is already causing the slow aging process. So for a basic home skincare routine, I think mid-20s is a good idea. Of course, for more aggressive treatments, maybe we'd want to wait for at least early 30s.
आपने कहा कि कोलाजन लॉस अपने 20s से ही चालू हो जाता है एंड I know I'll come back to the main anti-aging topic again, but collagen is very important when it comes to skin. And you said like we are losing collagen 1% after our 20s. Do you recommend or with so much of gummies, the collagen powders in the market, what's your take on that as a dermat?
So gummies, no. I think gummies are very gimmicky, if I should say, because you always have so much sugar, right?
Yeah.
So why are we going to have sugar and then try to do the anti-aging process? Collagen per se, yes. Again, there's a lot of controversy around collagen, but I'm a supporter for sure, because we have studies which show that collagen supplements, they improve your skin hydration, improve your skin elasticity, they reduce bone resorption, which I think is extremely important. So I definitely think they help in whichever way that they do. Oral supplements, not topical, because collagen per se has a large molecular weight. So applying it, I'm not really sure if it's going to get absorbed, but oral for sure.
Okay, just a follow-up question. मैंने खुद ने पर्सनली कोलाजन सप्लीमेंट्स को ढूंढना शुरू किया था एंड नाउ देयर आर वेज कोलाजन सप्लीमेंट्स देन देयर आर मरीन बेस्ड कोलाजन सप्लीमेंट्स सो इज वेज कोलाजन सप्लीमेंट्स आर इक्वली बेनिफिशियल बिकॉज आई रेड समवेयर दैट कोलाजन जो होता है मरीन वाला ज़्यादा अच्छा होता है सो इज वेज इज इक्वली गुड एज अदर नॉन वेज काइंड ऑफ कोलाजन
नो बिल्कुल इफ़ यू आर अ नॉन वेजिटेरियन तो फिर आपने marine hydrolyzed marine collagen ही लेना है because that's a better source. But of course we have vegetarian people who are not okay with having a fish source.
Yes.
So they get what you call pre-collagen or pro-collagen peptides. Collagen एक protein है. It is made of various peptides. So glycine and proline are two of the main peptides जिनसे collagen बनता है. So जो vegetarian collagen आप सुनते हो, they are basically those peptides which will contribute to the formation of collagen. So why not better than not taking anything at all? It's still a building block for your body.
Okay, so how does a lifestyle plays in aging your skin? Overall body, we are not talking about specifically skin. So how one should approach in their lifestyle, and what does it play in your
Lifestyle, I think, is can never be overemphasized. I think it's extremely important to get your lifestyle right, what we were just talking about a while ago. But everything, whether it's your sleep, not just how many hours you sleep, but what time you go to sleep, whether it's stress, better coping mechanisms of stress. And I mean, it's a whole, everything is a chapter by itself. Your diet, your nutrition, exercise, I think everything eventually adds up. So even if you're exercising, it's supposed to improve your muscle strength. Muscles secrete what we call myokines, which have anti-inflammatory properties. So they slow down what we call inflammaging, which is inflammation-induced aging of skin, body, whatever. Then you have better muscle tone stimulates NAD, which people talk about. Getting the right sleep, which is usually between 10 p.m. to 7 a.m., right? That's the window. Not just sleeping anytime reduces your stress levels in the body. So again, the oxidative stress goes down. That has its own anti-aging properties. And diet, of course, we don't want the inflammatory foods, so chuck all the inflammatory foods and include more anti-inflammatory foods.
Can you name some inflammatory food and anti-inflammatory food?
So 3 things I think are a no in general is dairy, sugar, gluten, right? So if you are not a big fan and if you're more of a health conscious, skin conscious person, I think you can just knock these off because they're known to be inflammatory. Sugar, of course, not besides your insulin sensitivity, it also causes what we call glycation of tissues of collagen, which accelerates the aging process. Dairy is known to be inflammatory, upsets your hormones, and that has an effect eventually. So your inflammatory foods would be all your cakes, pastries, cookies, pastas, the white, everything that's white, processed sugar.
But how about the natural sugars that are coming from fruits?
Yes, so I think you want to shift to the natural sugars. What I would recommend is pure date syrup. You want to check the ingredients because they say date syrup and they still add some kind of sweetener, which doesn't make sense. Coconut sugar. Monk fruit is something people are taking to a lot now. Monk fruit sugar.
Can you? I haven't heard of
So
that.
it's another fruit which is naturally sweet and doesn't spike your sugar.
Monk food.
Monk fruit sugar. So these are few things which are trending and which are safer options.
What do you think about jaggery in particular?
Jaggery is sugar. Honey is sugar.
But it's not a good alternative of sugar?
No. So these three are, I would say, the healthiest alternatives.
And what about stevia?
Stevia is a plant herb which is naturally sweetened. Problem is we have processed stevia. We have the powder, we have the pills, or we have the liquid. It's still a great option when you're trying to cut down your sugar, right, for diabetics and all. But if you want to go more healthy and more clean, you don't want processed food, right? So from that point of view, these are natural sugars. Stevia is still a good option if you're not fond of these.
So there's no replacement of sugar like in a healthier version apart from, you said jaggery is also
coconut
no.
sugar. It comes from the palm of the tree. You have date syrup and you have monk fruit. These are the most commonly used natural sugar.
आपने एक conversation में एक word use किया NAD, and I did heard about that word when I was looking out for anti-aging के अंदर क्या. What's your take on NAD? Can we consume it through IV or orally, and
So
does it help?
so of course that's a controversial topic and question, but I would think I personally would want to wait. We don't have any long-term studies on these, right? It is supposed to help with cell multiplication. It is supposed to give that raw molecule which has that anti-aging effect. But anything that's going to have that effect, we want to have long-term studies before we jump into it.
Talking about IVs and all, since we are talking about it, there's so much controversies going on, and there has been cases recently also. So people are just randomly taking IVs. Even people who are not dermatologists, they are just giving IVs in, like, even dentists and even normal salon. They are, even people are taking at home, calling just random people. What is your take on that?
So IV is not something that is not done with a proper board certified doctor, and we're talking about drips for anti-aging. It has to be a board certified dermatologist. It's a really bad practice to be doing this at home for the simple reason the high-end, good quality IV drips will never be supplied to non-doctors. Companies are very stringent. So the fact that you're getting it to do it at home, the quality is out, right? Plus, you're putting something in your bloodstream. You can't do it unsupervised. You can't have low-quality products. So that's the first thing which will cut down 80% of the market on IV drips today, right? Coming to IV, of course, IV has its own side effects, which I think is less talked about. And we can't say it is free of all risks, but under supervision, good quality, you could have the benefits. And you always have an option to take high-dose oral supplements for the same, molecule that you're chasing.
Yeah, so what is your take on vitamin C, glutathione, and all of that?
Glutathione initially was used for liver diseases, right? And IV drips are mainly given for that. So I would still say that we do see reversals of liver enzymes, and it's used for non-alcoholic liver disease. But it has never been recommended for fairness. It's not a fairness drip. And most of the patients who take it may not even see the fairness, right? Yeah. Which was a byproduct they found in some patients who were given the glutathione drip, and then it just got on like a fairness strip. So that itself is a flawed concept, right? It's a great antioxidant. You want to take it as an antioxidant, sure, but you also have tablets available for the same. So you could do the tablets as well.
Okay, so doctor, as a dermat, yes, I want a glowing skin. I'm fine with the complexion that I have, but when it comes to glow and glutathione को ऐसे associate किया जाता है कि it brings a glow and it will.
First, वो association ही गलत है.
So लोग इसको over the counter supplements के form में ले रहे हैं. IV is another thing. Obviously आपने कहा कि that should be monitored, regulated. आपको एक dermat का, लेकिन it's available as a supplement. We can consume it as a dermat. Do you prescribe glutathione, or people who are consuming glutathione without a proper prescription just as a supplement कि इससे फायदा मिलेगा? What's your take on that?
So if you're taking oral and it's a good brand, it's okay. Even if you're not prescribed by the dermatologist, but you are taking a good reputed brand, oral, it's fine, because most of the reputed brands will have formulations which are safe for OTC, which is over-the-counter sale.
Okay.
IV, absolutely not. IV is a clinic-done thing with board-certified dermatologists.
So you just said that people can start their anti-aging routine at the age of 20, 25, mid-20s, you
Yes.
said. But related to that, I have a question that do you think nowadays people are getting older faster or their skin is aging faster? And if you think so, what could be the reason?
So I'm not sure about the recent statistics on that, but one thing that I did recently read is that there is more depression prevalent in the younger population as compared to an average middle-aged one, and these are global statistics. So of course, when we talk about that and if we assess that and convert that to maybe stressful lifestyles, then that would cause more oxidative stress and more accelerated aging. Again, eating habits, if they're not the best, a lot of junk food, not very healthy lifestyles, then of course that would also add to accelerating the aging process.
Okay, so healthy lifestyle. Can you sum it up? You said that eating right, doing exercise, sleeping, eating correct, and we were also talking about collagen. So, what can we incorporate more in our holistic approach to, prevent from aging?
So I think I can never overemphasize sleep. Like I said, it's not just the hours of sleep, the time you go to sleep, because sleep is I would say like a natural night beauty clinic for you, right?
Yeah.
Because your DNA repair is happening. If you're sleeping at the right time, you don't have the cortisol peaks causing which are stress hormones in the body. So all of that happens if you get good quality sleep and at the right time. Besides, if the sleep is disturbed, then there is other issues which come in. Exercise, which we talked about, helps you to build your muscles. If your muscles are in good condition, they also release what we call myokines. They help to bring down inflammation, so they have anti-inflammatory property. So there's a concept we call inflammaging, which is inflammation-induced aging. So that's exactly where all these foods come in: anti-inflammatory foods, or lifestyles. So it brings down the inflammaging in the body. Also, your foods amount to the same thing. You want to cut down all the inflammatory foods, so no sugar, no dairy, no gluten, and you want to include the anti-inflammatory foods, which are rich in omega-3, your nuts, walnuts, salmon, fish oil. All of these help to bring down the
And some
inflammation.
vegetarian options?
So antioxidants in general, in which case would be flax seeds, a good alternative omega-3. For omega-3, you also have marine algae. So people who don't like fish oil capsules can have the marine algae capsules. Some of the good brands could give a good quality of omega-3 in the vegetarian sources as well. So yeah, that would help.
Okay, so doctor, let me ask you this. From your own personal experience in your clinic, in your practice, सबसे youngest patient आपने who specifically came for the anti-aging thing, like to you, the youngest of the lot?
Who came for anti-aging?
I mean, age, you can mention the age only.
So a lot of younger patients, I wouldn't do an anti-aging procedure for a young patient, but yes, we do have a lot of people in their late 20s or mid-20s who come for an anti-aging skincare routine by themselves. Yeah, but this is increasing. This reminds me of an incident. This is increasing because I had a 14-year-old kid who
14?
who says that, oh, I need to do something. I think I'm growing old.
What?
So because of social media, we have people, listening to these things. And I'm like, just because I deal with anti-aging, you can't ask me for anti-aging treatments at 14. So I think it's going down with, the way people expect to treat.
Tell me more about this conversation, about your interaction with
Yeah,
this.
So he had some pigmentation issues, which we were trying to address. And it's an old patient in a known family for a while. So, of course, they chat up. So suddenly, out of the blue, he thinks he's growing old. He says, I need to do something.
Yeah.
Yeah, that was a little...
So what's your approach when he's the person was 14 years old, and but I understand like there may be people coming.
So they know that I do these procedures. Their parents come to me for the procedures. So it's just that they're seeing and then they're wanting to do it much earlier, basically.
So this particular set of patients in this particular age group, do they come accompany with their parents, or
They come for whatever other concerns, maybe acne and stuff like that, right? But the thing is that they're very tuned to what their parents are doing.
Yeah.
So a lot of times we have mothers that, like, if the child is doing a laser hair reduction in the other room and we're doing an aesthetic procedure, Botox or PRP for the mother, she will insist, do not tell my daughter I'm doing this, because they go home and then the daughter wants to do exactly what the mother's doing, right?
Yeah.
So I think that's how they start wanting to do things very young now.
Since we are talking about younger people now, do you think losing weight can also make you older?
For sure. So this is something very less talked about.
Yeah.
It's not that losing weight makes you look older. I mean, we're not talking about ideal body weight and fitness here,
Yeah.
but it's the fat on the face. So as we are growing older, we're losing the elastin, the collagen, hyaluronic, which is the deeper part of your skin, or the dermis. We are also losing fat. So you have fat pads beneath that, the superficial and deep fat pads. So when you lose weight, say 4 to 5 kilos, that fat goes down in the face. So there's more facial sagging and there's more lines. So if there's somebody who's 40 and who's ideal body weight and BMI and a fitness freak, as opposed to somebody who's 40 and is, say, 10 kilos weighs more, is going to look younger, because then the fat acts like a natural filler.
Yeah.
Right? So definitely facial fat pads is something which play a huge role in the way you look.
So you're saying fat is not bad?
Good. Yeah.
Good
So the good amount of fat in a healthy BMI is not bad. And this I tell people all the time. So if you want to just gain a few 2-3 kilos, it just makes your face look fuller and younger, but provided it's a healthy BMI.
Yeah. Also, I have noticed, like, when I was younger, I was very, very thin. And you also know that I always have complained about necklines, and which I got quite early because I was very thin. So that could be one of the reason of losing fat, because you always tell me that you are very thin. Now
Yes.
I'm not.
You're still very thin,
Yeah.
I think.
And I've seen actresses, actresses who are just 20s, they also have necklines, and that could be due to losing weight, right?
So 20s, I wouldn't think it's the weight so much, right? Necklines can be genetic in a lot of people.
Okay.
But say if you're 30 plus, and then you've had weight loss, then probably that has come in because of the fat factor.
Yeah, because younger generation actresses nowadays, initially they are they are overweight, or they want to reduce and come to certain figure, and then they start getting this line.
Yes, so that applies to any age. So even if we have people who've had bariatric surgeries and suddenly lost 25 kgs, right? Or people who've lost 15, 20 kgs, then suddenly the face drops. It's like a balloon and the fat is filling it up, right? So we deflate the fat, obviously it's going to fall in. Your skin has only that much elasticity. It can stretch that much or recoil that much. You can't gain weight too fast, you can't lose weight too fast, because then the skin will sag. Either ways.
Okay, losing fat too fast or losing weight too fast
will make your skin sag.
But losing it naturally, gradually, because यही बोला जाता है ना कि आपका weight कम है, you start looking more younger. But if you lose it drastically too fast, then maybe the
all of lines. So all the fat pads will go down. So they have little sunken tear trough. There could be dissolvable folds. There could be a little bit of sagging because they've lost their lateral fat pads. So it depends on which age and what's their anatomic facial structure.
I specifically ask you about the 20s and the earliest patient you got. Let's say somebody who hasn't done skincare till their 40s.
Right.
Is it already too late for them to start?
So I always tell patients it's never too late. If you come to me for the first time when you're 40, you're going to look better when you're 50. If you come to me for the first time when you're 50, you're going to look better when you're 60. But if you want more prevention and you want a face closer to natural as you grow older, then you've got to start young.
So you're saying prevention is better than cure.
Absolutely.
And prevention in aging is much needed.
Absolutely, because the future is going to be cellular anti-aging. We're going to look at things which prevent the cell from aging. So the skin doesn't age or the organs don't age. So that is always the wiser way to do that.
Can you repeat that again? I found it quite interesting.
So
the future is, you
I
said?
think it's cellular anti-aging.
Cellular anti-aging.
Yes, so
What
we're
is-
like fixing. So, say a decade ago, we were reversing. People came with lines. They said, okay, my face is dropping. We want to fix it, right?
Yeah.
Now we are preventing that sag from happening. So, right in the 30s, we do collagen induction, radio frequency, skin boosters, HIFU, which is high intensity focus ultrasound, and non surgical facelifts in the 30s. Going forward, it's going to be about how you eat and nourish your cells. So, like I said, inflammation-related aging. So, we want to cut down the inflammation, oxidative stress, so antioxidants, which reduce the oxidative stress at the cellular level, right?
Wow.
Of course, there's so much in anti-aging, which is another chapter by itself, longevity experts and biohackers are talking about. But in short, we're not wanting the cells to age so
Oh.
that the skin doesn't age or
use-
the organ doesn't age.
we are going to not age faster in our future? Or future
depends-
generation is not going to
It
age
depends
faster?
on the application of the knowledge, of the lifestyle, of the nutrition, right? So if people can do that, and of course there are a lot of supplements coming in to support these things, I guess.
Wow, that's
It can be slowed down.
That's a life-changing statement. You just made it today. I
So
think.
the credit goes to, I think, the experts, and I think there's Dr. David Sinclair. He's a PhD Harvard expert in anti-aging. So a lot of the science is coming from him. I'm quoting him basically.
Looking
So,
forward.
Dr. Sama, irrespective of what age group a person is, one out of your top favorite dermat procedures that one can incorporate, irrespective of what age group they are in, that will actually help them stay good with their skin when it comes to collagen, skin elasticity, one dermat procedure that you recommend?
So if I have to choose one, my favorite is microneedling radio frequency because it's for all age groups, right? The other procedures maybe I wouldn't do for a certain age group. We do it even for acne scars when they have a lot of depressions because of acne, because it builds the collagen and fills up those scars. So I think without doubt, microneedling radio frequency is my favorite.
Okay, and then one anti-aging skincare ingredient that you'll ask everyone to incorporate in their routine.
One is difficult. You can't ask a dermatologist to give you one.
But yeah,
But if you have to
Highly
say
recommend.
one, I would say sunscreen.
Sunscreen.
It'll prevent the aging, prevent the pigmentation. So at least we prevent it.
Apart from sunscreen, like any actives.
Retinol is my favorite because it does multiple things. It treats acne. It has anti-aging properties in a different concentration. Maybe it treats pigmentation.
But there's a lot of controversy around retinol.
Yeah, I know. That's the really sad part because I don't think the problem is with retinol. It is the application techniques. So people don't know the right quantity, the right concentration, the method of application, the contact time, which is different for different people, right?
Please explain how to apply retinol properly.
Yeah, so whether we're using it for acne, whether we're using it for anti-aging, we'll be using a different concentration. We always want to do short contact to begin with if you're starting for the first time because you don't really know how your skin takes to it. So you wash your face, wait for 30 minutes, let your face dry up, and then put an extremely fine film, forehead, cheeks, chin. No
Remember
eyes.
on dry face.
Yes, absolutely.
On dry
30
face.
minutes after drying the face. When your face is wet, most of the actives absorb really fast and they irritate your skin. So we want to bring down that irritancy potential. No putting thick layers and massaging. You want to put a very fine film. Keep it for 30 minutes maybe to begin with, and then you could step it up to 1 hour. Wash, follow it up with a moisturizer, a good barrier repair, ceramide, hyaluronic infused moisturizer, and you're unlikely to go wrong. Now, whether you do it every night, whether you do it 3 nights a week, which concentration you use will, of course, depend from age to age and case to case.
But you're saying to wash it off, not to keep it overnight?
To begin with, yes. But we do have liposomal preparations now of retinols from some of these companies, which I think are non-irritant at all. In fact, they use triple retinols, which you can actually apply overnight with absolutely no irritation.
Tell me the different type of retinols you can have in different type of skincare ingredients.
We have different percentages. right? So we're looking at a 0.25 of
To begin with?
tretinoin
To begin
for acne. Okay, and we look at a 0.1% for anti-aging. There are multiple percentages. People have even come out with 2% retinol in the market. But of course, you'll always want to start with something smaller. And the higher percentages, you want to wait for your dermatologist to probably give you.
So, doctor, what's your take on retinol being formulated with other ingredient, like they are now cocktail kind of
Yes,
serums?
exactly. So very much. That's exactly what I said. We have certain liposomal preparations with retinol, with marine growth factors, maybe niacinamide. But when there are combinations, I think you have to be more careful and cautious because not all combinations are stable or going to complement each other. And sometimes people just want to put too many. So that's where a good reputed brand comes in. So you know they have done their work, they've done their research, and they're giving you a stable product.
Okay. About retinol again, because we are so obsessed about this topic. You can find retinol in serums, eye cream, creams. I think these are the things, right? So, do you need to use all of them or one product? If I am using a retinol serum, I can skip the cream.
Of course. And you use, so formulations will be as per your skin type, right? So if you have very sensitive skin type, you'll go for a liposomal serum. They're better absorbed. They can be less irritant depending on the formulation combinations. Creams can be used for baby skin that can handle good amount of stronger molecules. And you also have something we call microsphere technology. So for more sensitive skin types, they just deliver retinol slowly through the night. So again, that doesn't cause irritation, and you could probably do an all-night application.
Okay.
So it's not the retinol that is the problem. It is the wrong choice of the formulation, the percentage, the technique of application.
What is the safest percentage one can for a startup?
For anti-aging, 0.1%. For acne, 0.25.
Okay.
So, what's your take when you spoke about when the right product comes in, the formulation of the right brand takes a very important stage. I mean, it takes a very important place in one skincare routine. When it comes to price tag of a expensive cream, does that contribute to a good anti-aging product, or it just
So we have to give it to them. If the products are a little pricey, depends. Are they Indian? Are they imported, right? Imported products, of course, you're paying a huge amount of tax and import duty and all of that. And so it becomes expensive for us. But sometimes the premium products have more patents and have done more research and have superior molecules. Having said that, our Indian pharmaceutical companies have amazing dermocosmeceutical range in a very affordable range. So if you go with the reputed Indian brands, now they have most of the stuff available at very good prices.
Okay, what is the substitute of retinol if someone is not someone is sensitive to retinol and it's like totally no? If even after you have explained the way you
for anti-aging,
yeah.
So we'd probably look at glycolic acid. Peptides is the new thing. I think peptides help with anti-aging, and we have a lot of science on that, which are completely non-irritant. Hyaluronic, of course, would be whether you use retinol or not. Vitamin C helps with collagen building. So those are slightly on the milder spectrum, but they have.
So you said hyaluronic acid. So hyaluronic acid is also an anti-aging active?
Hyaluronic acid is more for plumping the dermis, I would say. So it is a part of the dermis which we are losing with age. And it can hold about 1,000 times its weight in water. So once you lose that, your dermis becomes a little less plump and shrunken, and then you start seeing fine lines. So hydrating well and using hyaluronic will help to keep that up. Having said that, depends. You have hyaluronic applications, you have hyaluronic skin boosters. So the application that you're applying has a half-life of 24 hours, which means you want to do it twice a day or every day, or it's out of your skin. Now, if you're looking for longer hyaluronic in the skin, then you have hyaluronic skin boosters, which then stay for 4 months in the skin.
So you just spoke about hyaluronic acid and how it retains the water 1,000 times more on the skin. Hydration when it comes to skin, like does consuming more water or being properly hydrated will show as less wrinkles on your face?
So from hyaluronic point of view, yes, because like I said, hyaluronic absorbs water, swells up, so that hydration would help you to have less wrinkles.
But consuming water?
Water is important,
Staying more
irrespective.
hydrated? No, staying in way of like staying hydrated, does it contribute to have less wrinkles on your face if people consume?
I wouldn't say it has any direct anti-wrinkle property, but hydration is important for basic functioning of the skin. So what we say cell physiology. So if you don't have enough water, your cell is not desquamating properly, you'll have flaky skin because the cell signaling doesn't happen well. So even for a proper cell physiology and a good skin barrier, you need to be well hydrated.
Okay. So tell me, what are the early signs of aging?
The earliest sign of aging is irregular skin color because, like we know, sun damage starts when you're very young, playing around. So there is changes in melanin in the skin. Melanin is your skin color, which is in the top part of the epidermis. But because of chronic sun damage, chunks of it can fall down in the deeper part of the skin. And then mid-30s, people start seeing irregular patchy skin. And that is dermal melanin, which is not cleared by your creams. So that's when you need your Q-switch NDAC pigment lasers, and that's your first sign of anti-aging, first sign of aging skin. Irregular skin color, then fine lines start appearing because your dermal content is going down. Fat is dissolving on the face, so sagging starts happening. Older bone resorption starts happening, so bony structure starts changing. So when the bone support goes, the fat drops more.
Okay. So you are talking about wrinkles now. So is there a specific area of our face that gets wrinkled faster, or it's like...
Not really. That's more genetic, I would say. Sometimes people have very early periorbital wrinkles or tear trough depressions. Some people have very prominent nasolabial folds, but I think that's more genetic and anatomical for each person.
So I read somewhere that first signs of aging appear around the eyes, neck, and the hands. Is it true?
Yeah, that could be because these are thinner skin. So periorbital is thinner skin, hands is thinner skin. Neck also what happens is most people are not taking care of their neck and hands.
Yeah.
People are not using their anti-aging creams or even sunscreen sometimes on the neck and the hands. So as you grow older, the aging is showing here much more than the face because they've been doing something for their face for years before that, right?
I can relate to it because I ignored my neck, and I keep telling in my content also. For years. I mean, only recently I started taking care of my neck.
Yeah, so that's, I think, a common mistake people make. So that's why it probably ages a little fast.
And in your profession, like, what's the different kind of skincare mistakes that you see people do, and anything in particular that still stays fresh on your mind?
Yeah, I think one thing we see practically every day is at least one person comes with a bag full of products that they have found from social media somewhere, somehow, and their skin has gotten worse. So this is like a daily, I think, one scene. So I think it's very important you know what suits your skin type and use it. And I think the other thing is starting late. So if they start late, they try to do too much, they overdo, and then it looks really bad.
As a dermat, you just spoke about too many products,
Yes.
too fast.
Yes.
Does layering, from skincare point of view, as a dermat, are you pro layering, or you say like one product at a time?
I'm not a fan of layering at all, because if you have put the first molecule, whatever it is, it's going to act better. It has formed a barrier, so the second one's going to act lesser, right? Maybe if you do a sunscreen first and then a moisturizer, okay, that works. But when we talk about actives, yes, I know there's a whole controversy around where people think they want to do the moisturizer first and then the sunscreen.
Yeah, I mean, sunscreen first.
I would think if you have to step out and you need good sun protection, sunscreen first, right?
Sunscreen first.
Because I have heard this for the first time.
Yeah, so there's always, I think, always opposing views on everything.
So you're not pro layering.
No.
In short, you're not pro
I think you can use different products at a different time and let it do its job. So rather than layering, what you can do is use combination products, right? So for instance, you have a sunscreen which can be hydrating and have skin lightening properties, right? You can have a sunscreen which has certain patented anti-aging molecules. Rather than layering, you pick a combination which is doing the two things that you want to do.
Okay, I have two follow-up questions here.
Right.
On the layering aspect only. Like, there are cocktail serums, like alpha-arbutin with niacinamide, alpha-arbutin or azelaic acid combined with something else,
Right.
which addresses two different concerns in one go. People are not layering, but they're using different.
So that's fine.
That's fine.
That's fine as long as it's a stable and compatible combination.
Okay. So, same question again when it comes to moisturizer and sunscreen. Nowadays, sunscreen are also cocktail. Like they with the SPF protection, there are niacinamide added, ceramides,
That's
hyaluronic
fine.
acid.
If it's in one formulation, that's fine.
So, can people choose to skip moisturizer if sunscreen is hydrating
Why
enough?
not? Of course. And in fact, we always plan routines like this because most people who are working and they're on the run, they can't do a lightening routine and then skin, moisturizing and then sunscreen. So depends on skin types. We always try to give combinations, like maybe a hydrating sunscreen with a lightening and anti-aging molecule at night. End of story, right?
But still, we'll go with the fact that sunscreen is a must for anti-aging. First thing that you already
Yes,
covered.
reapplication goes without saying.
Reapplication
Of
goes
course.
without it. But they can choose to skip moisturizer if sunscreen is hydrating enough.
Absolutely. Again, depends on your sun exposure. So mostly if you have hydrating sunscreens, you do have SPF 15 a lot. But like say if I'm out for a picnic or a holiday or, trekking, then I'm going to use a pure sunscreen with a high SPF, right? Because then we don't want to compromise on the SPF.
So sunscreen cream, sunscreen mist, or sunscreen wax?
And also stick.
Stick with the wax.
Stick is something I don't even know why it was invented, because you haven't washed your face, and especially say if you're acne prone or something like that, and you're just going to keep rubbing the stick on your skin, and it's collecting all the dirt and the grime and the bacteria, and then you're going to run it around, right? There's no way of disinfecting that stick. So stick is definitely a no-no, I would say, as far as I'm concerned. When you use sunscreen, you want the amount that covers 2 finger length for face and neck, right? Including your eyes and the ears. Mist is going to be not that accurate.
That effective, yeah.
So if it's like a touch up on the go where you just want to do it, but you don't have a choice and you have makeup, okay, but it's a compromise sun protection.
Okay, since we are talking about sunscreen, tell us the minimum and maximum that we can go to. If we are at home, what is the minimum we should wear, and if you're out?
So that's again a myth. A lot of patients, and so difficult to convince, but doctor, I don't step out of the house. Why should I reapply the sunscreen? So it's very simple. If you're sitting in a room and if I can see you, there's UV light. If there's UV light, there's UV damage, right? No house or no office is so dark that you have shut down the windows and you can't see, then you don't put the sunscreen, but that's really not the case anyway, right? So you have 80% UV rays coming inside the house even on a rainy day. If you have a desk job, if you're on the screen, like you said, you have a lot of screen time, there's a lot of infrared radiation from your tablets, phones, TVs, laptops.
Yeah, even the studio lights.
Absolutely. So if you're shooting, shooting, studio lights, surgeons, OT lights, right? So you have a lot of infrared radiation. So you also have sun protection from that, actually.
Yeah, so again, my question, the minimum SPF.
So you don't need higher SPF than 30 for Indian skin. The more important thing is to reapply it every 3 hours and to use adequate quantity. So people want to do 50 and 70 and now there's 100 SPF also, which I really don't think is necessary. Nothing is going to protect you for the whole day. Every 3 hours, 2 finger lengths, reapply, 30 work.
So you're saying 50 SPF is not required?
You don't necessarily have to if you're using it, great. But if you think you're using 15, you don't need to reapply.
No,
So
you
is-
have to
you have
apply.
to
So is it a myth or a fact? Higher the SPF means higher the protection?
Not really. It's about the amount of time that would sun exposure, but that would cause burning of your skin, basically. Right? So that's how those SPFs are calculated. It is not about how long you can stay without the sunscreen.
Okay. Okay, the difference between a normal sunscreen, like a creamy texture sunscreen, and fluid sunscreen.
So you have all sorts of textures, and you have gel creams, and you have water-based. It depends on your skin type.
All are effective.
All are effective, depends on your skin type. Acne-prone skin, water-based ones are better. Dry, mature skin, a more hydrating one, and maybe a cream-based is better. Lotion is less likely to hydrate. Creams are more likely to hydrate.
Okay, let's talk about facial oils now, because we are talking about products a lot. We have covered the actives, the sunscreen, and now facial oils. So what do you have to say about facial oils?
Again, I am not a big fan of oils in general, whether it's the face or the body. We have people who want to use oils instead of moisturizers also. So when we are trying to hydrate the skin, what are the needs of the skin? You need hyaluronic ceramides, which are essential for the skin barrier. Then you have certain aquaporin channels. Now you have which transmit the hydration to the upper layers of the skin. So we have products now which are working on the aquaporin levels. These are hydration for skin, right? Just an occlusive oil is not giving you hyaluronic or ceramides. The amount of water that you drink, like I said, 2 to 3 liters of water a day, helps your skin to exfoliate better because it maintains your barrier. So when we talk about skin hydration, these are important. Oil is not replacing any of this.
So the facial oils clog pores?
Absolutely. Most of the oils will not have the tag that it has been tested to not cause acne, right? So they're not going to be non-comedogenic. So if you have acne skin, makes again a problem. We see a lot of older people with dry skin, so they use oil. But when you have put oil, you wash it 2 extra times to rip it off. So you're actually ripping off the skin barrier in the process.
Since we are talking about anti-aging and oils, I have another question related to it, that does facial yoga can reverse your skin aging, or is it effective for aging?
So facial yoga is only about the muscles, right? We don't have much studies. This is one tiny study with some 30 people, which is not significant statistically for us as doctors. But even if I have to stretch my imagination, if you tone your muscle, what it says is maybe you could have fuller cheeks because the muscle is toned. However, the downside of it is the fact that we do Botox is because of hyperactivity of muscles, which creases your skin. So in all probability, if you're doing a lot of facial yoga, you're probably going to get lines earlier. And it's when you say skin sagging or anti-aging effect, it's the dermis, the fat, the bone, and the muscle. You're only going to be able to fix the muscle, not the other components, which are still going to age.
Okay, so people who are claiming facial yoga can reverse your...
I have no comments. We want papers, we want science,
It's
we want research. Yeah.
Okay. All right, so you're talking about Botox. I want to get there because it's again a controversial topic, Botox and fillers, and people who are doing it also, they are shying away of talking about it. I think it's high time to normalize it and take it as an advantage if people want to do it. And people, if they don't choose to do it, it's okay. But what do you have to say about Botox and fillers?
So I think, like you rightly said, we have more people who do it and less people who talk about it, right?
Yeah.
So it's not like people are not doing it, it's just that they're not talking about it. I will almost never see 2 friends come for filler together. Almost never. So it's like they don't even tell their best friends, right? It's that much of a secret.
Yeah.
But the point is, if it's overdone, if it's a naturally done job, and I always feel Botox and filler especially, the best job is like a no makeup look, where you've done the works, but no one can tell you've done it, right?
Yeah.
So when it's done like that, that's the way we want to use them as enhancing tools. We don't want to use them as tools that completely change the way you look, right? So unfortunately, because of certain examples like that, it's become a taboo. They're like, oh, I don't want to look like this one and I don't want to look like that one.
Botox and fillers are only done for anti-aging. Is it correct or not?
Not true. So we have medical applications for Botox. It is done for when they have bruxism. So when they are grinding their teeth too much and they start getting a lot of jaw pain because the muscle is really bulky. So we soften the muscle by doing it. For excessive sweating, for the underarms or the palms, we use Botox. It's supposed to reduce excessive sweating. Besides non-dermatological conditions, it's been used for migraine and torticollis.
Really?
Yes, vaginismus for women who have vaginal muscle tightening and difficulty in having intercourse. So there are a lot of medical applications of it for sure.
It has nothing to do with just anti-aging. It has other purposes.
Yes.
And same goes with fillers also?
Fillers, we do a lot of anatomical corrections. So sometimes there is deep sunken eyes in somebody as young as 22.
Loss of volume.
Genetically, they don't have that structure, right? So sometimes if they genetically have a structure that they want to fix, like sunken eyes, that's not anti-aging.
But so what you're trying to say, it's not always about aging, but it's the most used or talked about topic
Yes.
when it comes to aging. And then it is also like a controversial topic because people think that it's related to aging, so they feel that we are doing it because we are aging, but that's not correct.
Yeah, probably.
So
Yeah.
do you feel, or in your practice, do you learn that men age faster than women?
So I think men don't take care of their skin as much in their younger days as women. It's extremely hard for me to convince a male patient to use sunscreen. A lot of them, we do have a lot of male patients who come by themselves, but most of them are brought by their wives or girlfriends. So the care has been really poor, right? So from that point of view, yes, I think not taken care, more outdoor activities, maybe more outdoor jobs. So sun damage is more aggravated, maybe more stressful jobs. So stress-induced aging is faster, right? Smoking, if they're smoking, of course, that ages your skin faster. So many factors, I think, probably would.
But if somebody is doing the skincare on time, still, is there a different anti-aging routine for a men as compared to women?
No, there's no difference in the components, lasers, or treatments we'd use. It's pretty much the same. Men present maybe with slightly more aggravated changes if they haven't used.
But it has nothing to do, because I feel like my skin, I was told, or maybe I learned it, like my skin is more thicker as compared to my wife's skin.
So few things, yes. Like say if I have to, so when men are shaving, because of the shaving, the skin can get thicker, right? Fillers, yes. If you're doing fillers, we want a more masculine look. The way we do fillers for a male patient is very different from a female patient. We don't want to feminize the features. So those treatments differ for sure.
Okay, give us a basic anti-aging routine that one can incorporate in their skincare.
Okay, so I think I'm not a big fan of the CTM or the cleansing, toning, moisturizing routine. I think that's very hyped because most people don't have the time to do so many things. And yes, we want to use sunscreen, we want to use moisturizer because well hydrated skin ages slowly. And you want to use a pigmentation cream because Indian skin is always more prone to pigmentation, and you want an anti-aging cream. So where is the time for cleansing, toning, right? So I think you don't want to have it very elaborate, but you want a good moisturizer, a good sunscreen, one skin lightening, and one anti-aging cream. And if you're still too busy, maybe an anti-aging and skin lightening serum, which does both the job in the night, and a moisturizing sunscreen in the morning. So that's just two products.
So you're saying skin lightening treatment can be done in the morning and
a repair routine in the night.
You can do something like that, or simply use a hydrating sunscreen like we talked about it in the morning, and a combination serum in the morning, which will lighten as well have an anti-aging benefit.
So a serum, a moisturizer or sunscreen in the morning.
Yes.
A serum that will brighten, basically address the pigmentation issues. And in the night, a repair followed by a good moisturizer.
Also tell us some top 5 diet for anti-aging.
5. Okay, so 5 is difficult, but let me see.
Top 3.
I think, so rich in antioxidants. So I would say berries, blueberries, strawberries, whatever you have. Omega-3, so fish oil or flaxseed that you can incorporate. Protein, I can never emphasize enough protein, especially people are vegetarian. They're almost always deficient in protein. So simply every meal, breakfast, lunch, and dinner, you must have some source of protein. You can have fruits and vegetables of different color. So they give you more antioxidants. So they say 5 colors. Try to include 5 colors in a day for the antioxidant part of it.
What is your highest recommended clinical treatment or treatment that is done with procedure that you recommend for anti-aging?
I said a more universal procedure is, I think, microneedling radiofrequency. So you have multiple types of radiofrequencies actually, which is also important to know. We don't want bulk heating because it's going to reduce the fat on the face, which we talked about. We always want to preserve the fat as much as we grow older, especially on the face. So that's where microneedling radiofrequency is just the tip of the needles causing heat energy and collagen stimulation. So I personally feel that's one thing which is for all skin types.
Top 3 foods that people should avoid when it comes to aging, which causes inflammation.
Dairy, sugar, gluten.
What about caffeine?
Caffeine is, so depends. Caffeine is 1 cup a day, has a lot of health benefits. But there's a lot of there's no yes, it's not a single yes or no. So if you have acne prone skin, you probably don't want to have caffeine. You don't want to have caffeine first thing on an empty stomach because it affects your hormonal, peaks. So you don't want to have caffeine after 3 p.m. The last coffee should be before 3 p.m. because it disturbs your night's sleep, right? So there's a lot of things around caffeine. So not too much, and maybe 1 cup after breakfast. Again, you don't want to have caffeine after a meal because it reduces your food absorption, right? So it's a little tricky, but yeah.
Gut plays a very important role when it comes to skin. As a dermat, you are pro fasting, intermittent fasting for when it comes to anti-aging only.
For sure. I think there's a lot of science on intermittent fasting. Because when you're fasting, your cells are trying to survive. When they're trying to survive, they tend to stay younger. It's a very simplified version of I'm telling you of this, right? So intermittent fasting actually does that.
Wow.
So and of course it balances your insulin your insulin sensitivity, your sugars, and there's a lot of longevity studies which say it's better for a longer lifespan.
So yes to fasting.
For sure.
Okay.
But there's a difference in the way women fast and men fast. You don't want to do 16 hours fasting as a woman. That affects your ovarian function.
Really?
Yes. So if you're doing intermittent fasting, it's different for men and it's different for women. So you have to be able to preserve your hormonal health. So extreme intermittent fasting is not for women.
Oh, I do 24 hours.
Not at all. Not at all.
So what is the
So
minimum?
12, I would say, or 14 if you want to push it, definitely not more than 16.
So I think
That's shocking.
what
Yes.
I
So, there's lots of ifs and buts with these standard trends people know.
It affects your ovarian health.
Hormonal health. So when people go on extreme fasts and extreme diets, and we see this a lot, they'll suddenly stop getting their periods. Right? And then they start eating a bit normally, and a lot of deficiencies happen in the process. Another very important thing with intermittent fasting is your 2 meals have to be extremely well planned. You can't just eat what you find if you're doing intermittent fasting. They have to give you your macronutrients and micronutrients.
What is that?
So macro is your carbohydrates, proteins, essential fats, right? And micro is your manganese, selenium, and all your minerals, basically. So it has to be extremely well planned 2 meals if you're doing intermittent fasting.
Are you, when it comes to supplements, oral supplements for skin health, anti-aging perspective only, any top recommendations of must-have supplements in one routine?
For sure. If I had to choose 3, I would say hydrolyzed marine collagen, omega-3, and a good antioxidant, which could have CoQ10, astaxanthin, curcumin, green tea. There are a lot of combinations. So these 3 for sure.
So green tea, do you think it's an
Yes.
anti-aging?
Green tea is something that's, I think, if you can replace your caffeine with green tea, I think nothing like it. They definitely have anti-aging benefits.
We have to incorporate that because I'm it's just not happening,
Yeah, I think some people just don't have the taste for it, right?
No, it's just that our day is so occupied with taking so many things and we have routine. There's no space for green tea. Like we have only 1 cup of coffee, then when to have green tea, and we try to finish everything by 7, 8 o'clock. After that, we don't eat.
That's healthy actually.
Okay, what about exercise? Can it contribute to aging or can it contribute to youthful skin? Or what is your take on exercise? Because sometimes when we do cardio, people say that you lose fat from your face.
Yes.
But building muscle is also important for, as you said, that muscle is good.
Yes. Yes, absolutely. I think exercise has a lot of benefits. So you want a balance of cardio and strength training. A lot of people, in fact, just do cardio and neglect the strength training, right? So building muscles is important because healthy muscles, like I said, have myokine secretion, anti-inflammatory properties. They also stimulate energy production, mitochondrial repair, right? Cardio, it releases stress hormones, right? Like endorphins, which bring down the stress level. So the oxidative stress goes down. So definitely they have benefits in the long run. And you have something called sarcopenia. So after the age of 40, you start losing muscle mass. So if you do strength training and build your muscles, it's a marker of longevity. So again, it's an anti-aging thing actually.
What is your take on facial tools that claims that it can reverse your signs of aging or wrinkles. Like there are so many tools, especially from Korea. So what do you think about that?
Which kind of tools?
Gua sha, sculpting
Not
tools?
gua sha, like face lifting tools.
Okay, so I think the machines that we use in the clinic are very high powered. We use different kind of wiring and different kind of electrical setups, not your regular office setups also, right? So I cannot comprehend how a tiny handheld device is going to deliver the same energy and efficiency. So, of course, that's not possible. Clinic treatments are definitely going to be more aggressive. The more sophisticated a device, the better the safety profile, right? So, clinic devices are inbuilt with safety profiles. So, home devices will probably be very low energy, so not deliver. And if they're high energy, you'll have these risks, which probably may not be monitored if they're not very high-end devices.
Yeah.
Then you have red light, which is
Yeah.
okay.
I was about to come to that trend, red light therapy.
Which is I think a trend which is bigger. So red light is an LED light. Now, if I have to choose, I would choose a laser over light any day, because the lights are never going to be as powerful or as selective and as efficient as a laser. So, but if you want to use a red light at home, sure, it may have some kind of minimal stimulation, no damage.
That was a very insightful session. We covered everything, but
We had such fun talking to you.
I likewise, always, I think.
Otherwise, also off camera,
Yes.
we
before we wrap up the podcast, let's play a game round
Yeah.
about the myth and the truth. I'm sure we must have covered almost
Most
everything,
of
but
it.
still we would like to have this round. So you go first.
Okay, first question. You just have to say myth or truth.
Okay.
Okay. Anti-aging skincare is only needed after 40.
Myth.
Sunscreen is only for sunny days outdoors.
Myth.
Retinol thins your skin if you use it long term.
Myth, but if I should elaborate on that, it does what we call regularizes the epidermal keratinization, which means the way the skin forms. So again, it brings us back to what we discussed. It is the quantity, the contact time, which is different for every skin type.
And concentration as well?
Different for every
Okay.
skin type.
And also, how often should you use it? Like every day is fine?
A different skin type. Every day, alternate days, depends again from patient to patient and what your skin needs are.
Okay.
Drinking more water reduces wrinkles.
Indirectly, yes, true.
Facial exercises or face yoga can tighten sagging skin.
That's a myth.
Collagen supplements can actually slow down visible aging.
That's true.
Oh, okay. Men don't need anti-aging skincare like women do.
Myth.
Sleep is the most effective natural anti-aging treatment.
Couldn't be more true.
Yes, I agree.
Natural DIY remedies are always safer than clinical treatments.
That's an absolute myth. DIY was for the days when our grandmothers had no other options. We are spoiled for options today, so we really don't need to use those.
Any DIY mess up that got anyone to your
So
clinic?
many. So people would use fresh
Lemon?
Yes, lemon. And if you have slightest abrasions, it's going to cause irritation in the skin. People use fresh aloe from the plant. That can have irritation potential if the skin barrier is, not intact.
Yeah, even like I've seen, I don't want to name, but I've seen people eating aloe vera from the leaf for anti-aging.
Yeah. So I think we are way past that age and stage. We have much better sophisticated access.
Okay, so last one. You should start using anti-aging products in your 20s.
True. Why not?
You just covered
Yes.
that. We start losing our collagen after 20s, 1% every year.
Yes.
Perfect.
It was
It's,
such a great
very-
conversation with you.
Very
and
insightful.
My pleasure always.
With you, it's always like candid and like
Yes. I
off
think
camera also.
But anything last words from your end, if you think like we haven't covered certain thing or you want
Last
to...
piece of advice to
Yes.
our audience.
When it comes to anti-aging, obviously.
I think if I have to just sum it up, eat right, sleep right, and that is a science by itself. So first understand what eating right is and what sleeping right is, and always know that beauty is not skin deep. It is a holistic approach which will give you good skin.
Perfect.
Thank you, doctor.
Thank you so
Most
much.
welcome. My pleasure always.